Tervist, head saalis viibijad.
Dear participant, dear people in the room here and watching us over internet, dear colleagues, dear people involved in health promotion. We all want to be healthy. We want to be healthy ourselves. We want our family members to be healthy. We even want our neighbors to be healthy. On the state level, during a crisis and during the COVID pandemic, we stressed a lot that as an independent country, it is very important for us, and that means we need to have healthy people. People have physical and mental health, which is strong, and healthy people is the foundation for our state. But at the same time, a strong foundation is not going to be built on its own. We have a lot of institutions in Estonia whose task is to contribute towards health. And nobody's surprised right now if people talk about the health span, not only lifespan. So this is a topic which is very important for the Health Development Institute, Ministry of Social Affairs, to the Health Insurance Fund and many others. So as we Health Development Institute, we are a research institution. We carry out a lot of research. We have some studies which have lasted over 30 years where we can find out the health behavior of our people and the impact of it. So based on the latest research data, we have found that mental well-being of young people has gone down. We have seen more depressive episodes, more suicidal ideation. There is school bullying, which has ended up in cyberspace. Young people are lonely. Family relations are not very good, and these are all these risk factors and indicators which in long term also increase threat to use drugs or overuse drugs. During the COVID pandemic, due to restrictions, about 1/3 of young people in Estonia experienced the deterioration of the mental health. And there was also impact on the study results and physical activities. We saw that there was a lack of treatment and additional deaths. Use of alcohol and the deaths related to alcohol are showing a growth trend for many years now. We have seen the growth of drug overdose death as well. So by autumn, we have already we've already overtaken the drug overdose death a lot from previous year. Then obesity, lack of physical activity, lack of balance in diet. So all these things are factors which cause a lot of health problems. And this is a health loss. So young people today are impacted by the same topics in the future and will experience the same health loss in the future if we don't do anything about it. So the same way as on the state defense is not guaranteed only by one factor, then health maintenance doesn't have one magic wand which will fix everything. So population health is this kind of work which happens outside the medical sector, and promotion is definitely outside the medical sector. But at the same time, we should not forget the early detection of problems, handling these problems, and we're also happy to note that 6 ministries are working together for prevention, and they are aiming for child and youth health. When it comes to public health, it comes with certain problems which are interwoven with internal security and problems in the social field. But this means that if we set the focus well, we can do a lot with prevention. So today we can see that at the time of crisis, we have to work more with these problems who already have a problem and who need help. In the National Institute for Health Development, we can see that the treatment and rehabilitation capacity is full. We have not seen this for a while. We have to increase our contracts. Harm for alcohol use and illegal drug consumption has gone up, and mental health concerns have increased as well. The need for services, therefore, is going up. If when it comes to prevention, then we have a pan-ministerial cooperation framework. So we have a state-level prevention council, which works well. Then when it comes to assistance, then we need to develop this cooperation framework. Crisis has taken us in a very complicated situation. Maris mentioned the crisis of 1998 and 2009, and the crisis of 2007 and 2008. Then the Institute for Health Development had to suffer 30% of cut of budget, and we did not reduce any of the services which were offered for vulnerable groups, for harm reduction, and for the treatment of addictions. Because these budget cuts cannot happen on the expense of people, because that will be a very short-term view. And when it comes to prevention, then we don't understand very well what kind of benefit it brings to the state budget. When it comes to long-term, then it gives quite a serious impact. Early detection of problems, harm reduction, rehabilitation and treatment. This is when we have to discuss in the as integrated services of health care and social welfare. We cannot reduce the budget even if the crisis is very serious. This is something we need to remember, and we have to fight for that purpose. So I would like to thank all the cooperation partners, and I would like to thank the Ministry of Social Affairs, the World Health Organization, and also I would like to thank the Estonian National Health Insurance Fund, who is supporting prevention and shows us that in addition to treatment, prevention is also very important. I hope you all will be healthy. You will have the strength for this conference. Thank you.